Welcome to the Psychology World podcast. I'm Connor Whiteley, bringing you psychology news, articles, and other interesting psychology-related articles. Where you can find the podcast notes and more interesting psychology-related things, and you can get your free 8 psychology book box set at connorwhiteley.net. Now let's get on to the show. Hi everyone, and welcome to episode 93 of the Psychology World podcast with me, Connor Whiteley, and it is Monday, 10th of May 2021 as I record this, and today's episode is on what can your client do to help with their psychotherapy. So whilst I admit this is possibly my worst titled podcast episode ever, I still think that this is a brilliant episode for people interested in clinical psychology, whether you yourself are in a therapy and also clinical psychologist as a whole, though, because I think today's episode is really, really useful for the entire area of clinical psychology. So definitely listen to today's episode. And the reason why I'm recording this quite early, on the Monday instead of the Friday, is that because I'm taking sort of 2 weeks off the podcast just so I can focus on my exams. So I'm recording this week's episode and next week's episode, and then I'm scheduling them in advance. So even though this is a pre-recorded episode, there will still be a small psychology news section today because I managed to find some news articles that I've not mentioned on the podcast before. So moving on to psychology news section though. So we're reading from British Psychological Society Research Digest. Resolving arguments can prevent bad feelings from lingering, and we get better at this as we age. Open quote. Don't go to bed on an argument, close a quote, is an adage we've all heard and at some point probably ignored. As it is, the phrase does have some truth though, because resolving arguments rather than letting them simmer away can make us feel calmer and happier the next day, and it actually makes it easier to actually get some sleep. Now, a new study has looked at the benefits of resolving arguments, and the team finds that not only can resolution almost erase the emotional stress associated with a big argument altogether, but individual differences can affect how well we do it. The older we get, they find, the less we argue and the better we are at dealing with argument-related stress when it happens. And this, I think, is really interesting because I really do understand the logic, or the possible reasoning behind we argue less as we get older, simply because if you've been with your partner for about 30 years, then you've known them for a minimum of 30 years or maybe 32 years. And because you've known them for so long, then it's actually quite likely that you would know each other, you would know all of your flaws, and chances are you would have learned how to deal with them. So in that sense, I do understand why you might argue less. But I think the takeaway for today's psychology news section is just, the research has supported it, so I would just say, if you've had an argument, please just don't go to bed angry. Of course, that's not official advice, but still. So the last one is, people hold negative views about those who believe life is meaningless. That is really weirdly titled though. Open quote. The only absolute knowledge attainable by man is that life is meaningless. Close a quote. Wrote Leo Tolstoy in A Confession. A precise summing up of the nihilist worldview. Depressing as it might be, nihilism and I do really apologise in case I'm not saying that properly, seems to be on the rise, with the importance of finding a meaningful worldview steadily decreasing over the last decade or so. So, how do other people feel about nihilists? This is the question proposed in a new paper, which finds that stereotypes of nihilists are overwhelmingly negative, and unlike stereotypes about atheists, which can be both positive and negatives, people don't seem to have any positive views about nihilists at all. And this, I think, is really interesting though, mainly because, meaningful life, social groups, structure, social order, all ways that we combat the inevitability that we're going to die, as outlined in terror management theory. So this actually doesn't make a lot of sense from a psychological perspective. The life is a meaningless viewpoint, because I would not be surprised if this leads to decreases in mental health and increases in mental conditions like depression and anxiety. So I do understand why people wouldn't want to believe in this because I think it's quite terrifying to think that your life is meaningless because you're going to die. Personally, I do not believe it, because if we think about it, the people who invented the internet, would you say that they lived a meaningless life? Because the internet will most probably be the bedrock. It will probably be as important as us inventing fire. No, I do not believe it one bit, but equally though, it's just my own opinion, and I had no idea where that was all going. And as this is pre-recorded, there's no personal update. But as always, I always love to know your thoughts and feelings on today's episode. Especially, I really want to hear your thoughts on the nihilism, though, and the viewpoint that life is meaningless. I would love to get people's opinions on that. So, as always, you can always email me, connorwhiteley@connorwhiteley.net. You can always leave a comment on the show notes at connorwhiteley.net/podcast, and you can always tweet me on Twitter at sci-fi-whiteley. And this episode has been sponsored by Clinical Psychology. And this is a great psychology book that goes into what is clinical psychology and all of the little bits that make up psychology. For example, where do clinical psychologists work? What models of therapy can they use, and also it goes into a clinical psychology careers a bit. So it's a really engaging, really easy to understand book that if you're interested in clinical psychology, I really, really do recommend that you get this. And the audiobook is now out. I think it's been out for 2-3 weeks now. So it's available on all major ebook and audiobook retailers, and you can get the paperback and the hardback versions from Amazon or your local bookstore. So we're moving on to the content part of today's episode. So we're going to be talking about what can your clients do to help with their psychotherapy. So this episode is designed for people who are and aren't a clinical psychologist. And the way how I'm going to do this podcast episode is that after each thing, I'm actually going to explain how it can apply to clinical psychologists and people in therapy. So a lot of people might be thinking that a therapist shouldn't need help to deliver a therapy to their client or a mental health sufferer. And I want to remind people that in clinical psychology, the word client is a lot more helpful and it's a lot more humane to describe a mental health sufferer as a client rather than a patient, because a patient makes it sound like they've got a disease and it can be magically cured and all of that quite negative stuff. It's the exact same reason why I don't use the term mental health disorder or mental health problem, because a problem makes it sound like it's your fault when it's actually not. Anyway, though, but as I talk about in my books, unless a person wants to change, then psychotherapy is useless, because the therapy is all about the relationship between the client and the therapist. And because of this, there are a number of things that your client or the mental health sufferer can actually do to help their therapy be successful. And that's what we're going to focus on today's episode. So there's 5 things. So the first one is understand the rules. Firstly, when you're in a therapy or when you're a clinical psychologist, you need to make sure that the client understands the rules. And this I actually had to really, really think about when I first heard about it, because I didn't really understand what rules there were. But some of these rules include the payment schedule, the boundaries of the professional relationship, how the confidentiality works, and lots more. And the reason why this is important, because this tells the client how the therapy works and what they can and can't do. And knowing this helps prevent bad situations later on. So the second one is be honest. And this, I think, is just absolutely critical, because the therapist needs us to know what's happening, and they need to know various pieces of information depending on the psychological model that they're using. For example, if you've got a psychoanalyst, then they're going to be more interested in the cognitive unconscious and your childhood memories. Whereas a cognitive behavioural therapist would want to know about your thinking patterns and your cognition. Overall, this is why it's important for clinical psychologists to develop a sense of trust and a rapport with their clients, and to encourage them to be honest, because it's critical for the client to be honest with the therapist so that they can try and help the client as best as they possibly can. The third one is be open. So this really does lead on from the last point, because clients need to be open with their therapist too. For example, telling them when something's wrong, when they don't think the therapy is necessarily working, or when they're going to have problems paying for the therapy. And of course, yes, I'm talking about private therapy here. And as scary as it is, all these concerns do need to be raised up front, just so solutions can be created. And for clinical psychologists in particular, this means being kind and approachable and making sure that the clients know that they can talk to you. And then for clients, what this means is that it means that you need to try and find the therapist in the first place that you feel comfortable with. And we've all had these difficulties at some point in our life, so don't feel ashamed. Number 4, apply what you've learned. And this, I think, is possibly one of the most important out of these 5. So during a therapy session, the client will learn things. For example, how to cope in a certain situation, a number of better or good coping mechanisms, because as I talk about in the clinical psychology book, the main reasons why these mental health symptoms happen is because they're bad coping mechanisms. And then it also goes into patterns of behaviours or thoughts that you need to watch out for and more. So as you can see, there's plenty of things to learn in a therapy session. But all of this is actually useless if the client doesn't use anything that they've learned in therapy. So this is why it's actually critical for clinical psychologists to get their clients or patients to understand the importance of practicing and applying what they've learned in their lives outside of the therapy. And then I'm talking to the clients and the other people in therapy here. It's up to you to use what you've learned, since if you apply this knowledge to your life, then it should improve. Of course, no promises, but it should. And then the last point, though, is do the homework. And this really does follow on from the last point, because this is one way how the clinical psychologist or the therapist can actually make them use the stuff that they've learned inside the therapy sessions. Because this is the benefit of doing the homework. And another benefit is that because a clinical psychologist can actually use it to start a series of habit-forming behaviours that get the client to apply their knowledge automatically, of course, in the outside world. And as psychotherapy can take several months, this time frame gives the psychologist a lot of time to think and this habit to form. So whilst the homework is optional, because my clinical psychology lecturer, she was terrible at setting homework for her clients, like she had to tell us. But as I mentioned in my book, setting homework also depends on the therapeutic model used as well. For example, CBT, that is brilliant for setting homework on, because CBT can actually be really visual. But personally, because of all the research I've done into clinical psychology and therapy, I do think that if a clinical psychologist can, and if the therapeutic model lends itself well to homework idea, then I do think that they should set it, because you can only deal with so many difficulties and you can only develop so many skills in a therapy session. And equally though, I strongly believe that a client should actually do the homework if it's given to them, because if a therapist is giving it to them, then it is for their own benefit and it should help them. So I really hope that you've enjoyed today's episode. If you know someone else who would find it useful, then please share it with them. I'm always really grateful when you spread the word about the podcast. And also please check out Clinical Psychology, available on all major ebook and audiobook retailers, and you can get the paperback and the hardback copies of the book from Amazon or your local bookstore. So have a great day everyone, and I'll see you next time. Thanks for listening today. I hope you enjoyed it. If you want to see the show notes, then please go to connorwhiteley.net. And if you want a free 8-book psychology box set, then please go to connorwhiteley.net. Have a great day, and I'll see you next time.